To be introduced by Chris, you really feel great after all that. As Senator Carper always says, you just got to be careful not to inhale. I'm really just delighted to be here with all of you and to be in Delaware with our congressional delegation and our governor. This is a place, as Chris said, that really works. And I think the people in this room, people from the university, from Christiana Care, from Nemours, through these grant applications, through the work that you're doing every single day, show how you work in delivering health care to our communities. We try to do the same as a delegation. I want to thank Senator Carper in particular. It was said by Kathy at the outset that he was the one who set this up. It's not surprising to me because he worked so hard to make sure that innovation was such an important part of the Affordable Care Act. This is the way to bring health care costs down. Both of my colleagues in the upper chamber have emphasized how important that is for our country and what a big challenge it is. I remember back, for new members of Congress, I've only been over in the House now for about a year and a half. And before you're actually sworn in, they have a new member school that they send you to. And I remember the new member school fairly well. They sent us up to Harvard, and there were actually a lot of members who didn't go just because they thought that Harvard was the kind of institution that was not so much consistent with how they wanted to be perceived by their constituents. But we had several panels. One I remember in particular about the budget deficit and the accumulating national debt. It was chaired by a woman by the name of Maya McGinnis. And Maya is doing tremendous work in the nation's capital with the Center for Responsible Federal Government. She works really hard to get members from both sides of the aisle, in the Senate and the House, to come up with plans to address our deficits and get our fiscal house in order. And I remember in particular her saying, as both Chris and Tom have said, that the biggest challenge in getting our costs under control are escalating health care costs. Because of the demographics, I read recently where the population 65 years and older over the next 20 years is going to double, while those under 65 is only going to go up by 20 or 25%. You don't have to be a mathematician to figure out, if you know how Medicare is funded, where we're headed with those kinds of numbers. So I asked her after the whole panel, I put my hand up and I said, so tell me about the good ideas that are out there in the country to bring health care costs down. And she paused for a long, long time and she said, well, I'm not sure what they are. In fact, I'm not sure that there are many ideas. Well, the fact of the matter is, there are lots of good ideas. Some of those ideas, we don't hear much about it, because all we hear in the debate over the Affordable Care Act, so-called Obamacare, is all the bad things or the things that we're afraid of that are going to happen. But there are a number of things, like innovation, like accountable care organizations, like patient-centered medical homes, that are intended to change the way we deliver health care in our state and our country, with the intention of bringing down healthcare costs. So this grant, it's so exciting to be here in this room today, to see all of you have put together a tremendous grant. Somebody thanked me for our letter. Our letter is a small part of grant applications. You all do all the work. Because it involved just that. We have really a choice. We're going to bring down healthcare costs one way or the other. We can either do it the smart way, by delivering, as Senator Carper likes to say, by getting more for less, right? Delivering more for less. Or we can succumb to some of the ideas that have put out there where we just cap the amount of federal commitment and we provide block grants to the governor and to the states, or vouchers to those over 65 or on Medicare. I rather think that the best way to do that is through innovation and through the changes to patient care that this grant and the concepts in it represent. So I want to thank all of you for the tremendous, this is, when you think about it, you roll it all the way back, this is the most important challenge facing the country. So the work that you are doing on these grants, coming up with the best ways to do things, is the most important work going on in our country right now. I really believe that. I see it every single day. So I want to thank you for that great work. And I want to turn the podium over now to my good friend. It is difficult, very, very difficult, to be a governor at any time. It has been extraordinarily difficult to be governor over the last 4 years. And we have a man who's done that job in an incredible fashion, both on the financial side, in terms of economic development, healthcare, addressing all the important issues that face our state. We get just tremendous leadership from our governor and member of our team, Jack Markell.